Hi, my name is Shania, and the disability that I researched is bulimia. Bulimia is an eating disorder in which a person participates in episodes of overeating, also known as binging, and this is then followed by purging through methods like vomiting or the misuse of laxatives. There are two types of bulimia. The first type is the purging type, and in this method, people participate in self-induced vomiting, diuretics, enemas, laxatives, etc. to clear their intestines. And the second type is the non-purging type, and this is the method where people use other behaviors like excessive eating instead of other purging behaviors. According to the Diagnostic and Statistical Manual of Mental Disorders, a person has to meet the following criteria for them to be diagnosed with bulimia. So, a person has to experience recurring episodes of binge eating in which they're eating a larger than average portion of food in a small amount of time under normal circumstances, and there is no control over eating. The next expectation is that their self-evaluation is highly influenced by body shape and weight. The next is this person experience recurring inappropriate behavior to combat weight gain. Next is binge eating and inappropriate methods of fighting weight gain don't exclusively happen during episodes of behavior that are commonly linked to anorexia. And then the last expectation is that this person's binge eating and inappropriate methods of fighting weight gain happen at least once a week for the course of 3 months. Some signs and symptoms of having bulimia include disappearing after meals, low self-esteem, skipping meals, some more physical changes like tooth enamel erosion due to contact with some stomach acid to the teeth that can make a person's teeth deteriorate, swollen salivary glands, and also calloused or cut knuckles due to self-induced vomiting. Some causes of bulimia. The first cause is biological factors, and although there isn't a gene that directly passes bulimia down from a parent to a child, there are studies that propose the idea that a familial component tends to be present when a person has an eating disorder, and this is most common when first-degree relatives of people with an eating disorder are very highly likely to pass that eating disorder. The next cause is peer pressure and the influence of media. With so many forms of media portraying unattainable beauty standards, it can be really hard on a person's mental health to feel like they're not matching the status quo and not fitting society's expectation of beauty. And then there are other potential causes such as child abuse, trauma, depression, anxiety, etc. There are some treatment approaches to helping an individual dealing with bulimia. The first treatment option is psychotherapy, and so cognitive behavioral therapy can really help a person develop regular healthy eating patterns and replace their unhealthy behaviors with good ones. And through psychotherapy, individuals battling an eating disorder can also attain family-based treatment so that people around them, not just their therapist, can help them battle with their eating disorder. The next one is antidepressants, and antidepressants can help reduce bulimia symptoms, especially when used with psychotherapy, and specifically the only antidepressant currently approved by the FDA to treat bulimia is fluoxetine, also known as Prozac, And the third treatment approach is nutrition education. So dietitians can help individuals dealing with bulimia design an eating plan, but in most cases, or in severe cases of bulimia, people dealing with bulimia have to be treated through hospitalization. Some impacts on the family. Family members can experience a great amount of guilt and helplessness. They feel that they could feel that they haven't done enough to help their loved one deal with their eating disorder, or they could have prevented it in some way. They could feel responsible for their loved one's struggles. They could have the idea in their minds that they could have done better, been more supportive in order to prevent their loved one from having bulimia. And they could feel really helpless in helping their loved one because they just feel really angry and frustrated with either the disease, the individual, or themselves. Some social effects that bulimia can have on an individual. A lot of the social effects greatly influence a person's relationship with a significant other. There have been a lot of studies reporting that individuals with bulimia have a lot of intimacy problems and often make comparisons between themselves and others. Some agencies that I found that can help individuals battling an eating disorder, specifically bulimia. The first one is the National Eating Disorders Association, and this association provides support, resources, and treatment for people struggling with eating disorders, including a crisis text line. The second agency I found is the Cambridge Eating Disorder Center, and this center provides 24-hour support to women struggling from eating disorders. They actually have a 37-bed program for medically stable girls and women 12 and older with anorexia nervosa, bulimia nervosa, and binge eating disorder. And then the third agency I found is the Center for Eating Disorders Management. And this organization collaborates with an individual's primary health care provider during treatment to ensure quality medical and mental health management. And they also provide medical and psychological evaluation for clients with eating disorders, individual psychotherapy, eating disorder recovery groups, and more. And then an additional resource that I found is the National Association of Anorexia Nervosa and Associated Disorders. And this organization provides free support and education to those struggling with an eating disorder. And here's my works cited. Thank you for watching.